Dr. Gautam Desai is here to talk with us about RSV.
RSV, yeah, it's been in the news a lot the last couple of days. Good morning, Dr. Desai.
Good morning, Nick and Abby.
Dr. Desai, let's start with a simple definition. Tell us what RSV is.
Well, we hate to try and pronounce respiratory syncytial virus, so we just say RSV, but it's a virus that can cause infection or inflammation of the lungs. And, most of us get it by the time we turn 2, but it's just been traveling with a lot more earlier frequency than it has in years past.
Yeah, and I think what is so scary about RSV for parents with young children like myself, it can go from a cold seemingly to very serious, it seems like in a matter of hours. So how can you tell the difference between RSV and the flu or cold?
Yeah, that's a great question, Abby, and it's really difficult to tell just from looking at a patient. That's why we'll do lab tests that will check for COVID, RSV, influenza to try and find out what it is. But little kids just have much smaller airways, and they can get plugged with mucus really fast. And that's why, as you said, it's terrifying to see a kid go from breathing all right to suddenly having a lot of trouble breathing.
Dr. Desai, why are so many cases, diagnosed in October and into the fall and winter months?
Yeah, Nick, that's another great question. So right now, all around the world, the viruses are not reading the books and not following their rules of the normal appearance times. COVID definitely played a role. When everyone was masking in 2020, RSV was almost, non-existent, but then it seems to have come back with a vengeance. As we stopped wearing masks, people had less immunity because they didn't get it the year before. So all these different viruses, flu, adenovirus, and RSV are just coming on at different times, and it's hitting a lot earlier than it normally does.
And I think one thing about RSV people need to be aware of is for a lot of people, you could have RSV and it's going to be just a blip on the radar, right? So why is it that certain populations get hit harder and need to be more aware of the virus?
Yeah, so most of the time adults, if they get RSV, or older kids, you may not even know it. You'll think you just had a cold or allergies. But in people that are over the age of 65, as well as those less than 1 year of age, people with chronic heart or lung problems or who have immune compromise, it just hits really hard. So you have to be more vigilant in those populations.
Dr. Desai, I think you may have answered this question here. Can adults pick it up? It sounds like if you have other factors in your health that you become possibly could be susceptible to RSV. Does that sound right?
Yes, that does sound right. So adults get it most of the time, we're fine. But if you're immune compromised, the heart lung problems, you can definitely get it for, a longer time and hit you much harder. And every year, about 14,000 adults die from RSV.
Wow.
In the news business, we love headlines, Dr. Desai. And one that we've had in the last few days is the triple-demic: COVID, influenza, and RSV. What do you recommend? What's your advice to people watching right now when it comes to that? We see a story like that.
Yeah, so if you are the parent of a, child less than 1 year of age or live with someone who's immune compromised, even though it's a pain, I would follow the same precautions that we used to do when COVID first came out. I remember wiping down the mail with bleach wipes or food packages, but you don't have to go that far. But at least be very vigilant about washing hands, sanitizing surfaces that maybe have been coughed on, or toys, especially if someone is going to daycare or something. It can spread pretty easily. So just taking good hygiene precautions would help in preventing that.
All right. Dr. Desai, thank you.
My pleasure, Abby. Nick, have a great week.
Thanks, you too.